Assalamu alaikum. I hope you all are doing fine. This lecture is for pharmacology TPT class, and I'm Dr. Ayesha Iqbal. The topic for the lecture is factors affecting dose and action of drugs. So let's get started. The learning objectives for the lecture includes that you should be able to enumerate the factors affecting dose and action of drugs, states the formula for calculating the dose of the drug according to age and weight, explain the interaction of drugs, explain synergism and summation, and potentiation and accumulation. So the factors affecting drug dosage include age of the patient, sex or gender of the patient, body weight, severity of disease, pathological state or condition, tolerance, time of administration, frequency of drug administration, route of drug administration, idiosyncrasy and hypersensitivity, interaction of the drugs, accumulation and potentiation. So we will be discussing all these factors one by one. Whenever a patient comes to you, you need to keep in mind the age, gender, and the weight of the patient, and accordingly, you give the dose of the drug. So, in general, children require smaller doses than adults, following the formulas that are used to calculate the dose for children. First is this Young formula in which child dose is equal to age divided by age plus 12 into adult dose. Second is Stilling's formula in which child dose is equal to age divided by 20 into adult dose. Any of these formulas can be used to calculate the dose of drug for children. So as discussed in the previous slide, that weight also matters and it is one of the factors that affect dose and action of the drug. Basically, drug concentration at site of action is based on ratio between the amount of drug administered and size of the body. So, the dose calculations for abnormally thin or obese patients are required to calculate on the basis of the body weight. That means simply like if you are calculating the amount of drug administered and the size of the body, then that is the ratio of these two things makes the drug concentration available at the site of action, right? So you need to see that what is the weight of the patient, and accordingly you need to administer the drug for the required amount of drug concentration to reach the site of action. This is a Clark's formula for calculating the drug dose for a child according to its body weight. The child dose is equal to weight of child in pounds divided by 150 into adult dose. Now you know the formulas. I want to ask you a question for the assignment, which is state the formula for calculating the dose of drug according to age and weight. You have to submit this question along with your assignment. And the next questions that I will be asking in the end and maybe in between the assignment. Next is gender or the sex of the patient. Females generally require low doses because of the difference in their metabolism, and in men, biotransformation is more active. You also need to consider that the patient is either pregnant or in a lactation phase and accordingly adjust the dose. Pathological state. If the organ through which biotransformation and excretion takes place are diseased, then smaller dose is indicated. Like in case of renal insufficiency, phenobarbital should be given in smaller dose. And in case of patients suffering from liver disease, morphine should be given in smaller dose. But in certain diseases, dose of the drug may be increased depending upon the severity of disease. So you need to see whether it's the severity of the disease or the pathological condition or the state of the organ, right? And then you need to adjust the dose. Tolerance. Tolerance can be acquired due to repeated administration of some drugs. We need to keep in mind that it is also one of the factors that affects the dose and action of the drug. Now, the time of administration of a drug. The time at which drug is administered influences the dosage. So whether it is being administered when after the meal or before the meal, and absorption proceeds more rapidly if the stomach and upper intestine are free of food, while some drugs are better absorbed after meal. So you need to keep in mind that time of absorption is also a factor that affects the action of drug. Then the frequency of administration of a drug. Drugs having shorter half-life gets rapidly excreted from the body, and in such cases, to maintain steady plasma concentration, frequent dosing is required. Route of drug administration. You have already studied all routes of drug administrations, and you guys know that the bioavailability of drug in different routes of administration is different. Accordingly, dose of drug will be different for different routes. Thus, in general, intravenous dose of a drug is smaller than an oral dose. Idiosyncrasy and hypersensitivity. Idiosyncrasy is genetically determined abnormal or unusual response to a drug, while hypersensitivity is an adverse effect to a particular chemical resulting from a previous exposure to the substance, occurring in only a small fraction of all people receiving the particular drug. So you can differentiate that idiosyncrasy is the abnormal or unusual response of the drug, while hypersensitivity is an adverse effect. Interaction. Interaction could be with the drugs or with the diet or food or dairy products. Like antacids in dairy products may decrease the absorption of some drugs like tetracyclines, while presence of food in stomach may decrease the absorption of some drugs like propranolol. Sometimes carbohydrate or protein-rich foods also interact with the drug, so you need to keep in mind that interaction is one of the factors that can affect dose or action of the drug. Interaction of drugs. Interaction of drugs is when the effect of combination of two or more drugs creates any action, which can be summation, synergism, or the antagonism. Let's talk about summation. When the total pharmacological action of two or more drugs administered together is equivalent to the sum of their individual pharmacological action. So it is actually the final effect, that is the sum of all the drugs given, right? Like example is aspirin and codeine, which are codeine is opioid agonist and they cause the analgesic effect. Second is synergism. Synergism is when two or more drugs given together results in a total effect greater than the sum of their independent effect, and this is known as synergism. Levodopa and carbidopa is the example. Third is antagonism. And what happens in antagonism is that combined effect of two drugs is less than the sum of effects of individual drug, which means that one drug actually decreases, opposes, or reverses the effect of other. Let's see the definition now. When action of one drug is opposed by another drug in the physiological system, it is called antagonism of drug, right? The example, or there are many examples, but first you need to know the types, and then under those types there comes the examples. There are basic four types of antagonism, and you have already studied that. You will be answering me the definition and the types of antagonism in your assignment. Potentiation. The effect of one drug is greatly increased by the intake of another drug itself without notable effect. Here, the effect of one drug is increased greatly by the intake of another drug. When you take another drug, then the effect of one drug is increased. Like when you intake erythromycin, which potentiates the effect of ergot derivatives. Here you need to remember the difference between potentiation and synergism, which is that synergism is about interaction of two or more substances, while potentiation is about a singular substance and how it may act when in synergy relationship. Okay. Accumulation. Any drug will accumulate in the body if the rate of administration is more than the rate of elimination. For example, if a drug is excreted slowly, its repeated administration may build up sufficiently high concentration in the body to produce the toxicity. So if you keep on taking the drug and it is not eliminating, then it might develop the toxicity with its accumulation. The example to remember is digitalis. Thank you so much for listening. This was your lecture for today. And I have already asked a couple of questions for your assignment in the previous slides. Now I'm going to ask the last question, which is the third question. State the factors affecting dose and action of drugs. So now you have three questions that you will be submitting. Thank you so much. Allah Hafiz.